Now let's talk about diagnoses. So you'll see a lot of diagnoses. Sciatica is a big one. Oh, your sciatic nerve must be inflamed because you're getting pain radiating down the pattern of the sciatic nerve. Well, Travell and Simons point out that sciatica is not a diagnosis. It's simply an observation of a pain pattern, and you cannot assume it has anything to do with the sciatic nerve. Uh, Trigger points can easily mimic this pattern, and 90% of the time, it's trigger points that are doing that. Trigger points in muscles. It has nothing to do with the nerve. And if you don't know that, which most people don't, honestly, um, they're operating on a completely false assumption. These diagnoses are disempowering because then it leaves us in the hands of either a surgical procedure or a drug. In other words, it's going to cause us to go spend money, get our bodies cut open, and undertake medical procedures, expensive medical procedures, and those often don't work, but they put money in the hands of the health corporations and surgeons. And so my work has been devoted to kind of bringing awareness to this because we have success with almost all the pain that we work with. And many of these people have been failed. They've been failed by multiple surgeons, uh, PTs, many other modalities. So it's all because of the understanding. It isn't because of some magic technique that I use. It's the understanding of where the pain is actually coming from. And so that's what you really have to get to. So this injury model is just built into our medical system. This was an image that I found on a surgeon's website. Types of shoulder pain. Well, it's funny to call this types of pain because these are types of disease and injury. Bursitis, arthritis, tendonitis. These are common throwaway garbage diagnoses. They don't know that that's where your pain is coming from. They localize it based on where you're feeling your pain. Oh, it's over your bicep tendon, so you have bicipital tendonitis, and that's just nonsense. Uh, when you know trigger points, you realize very quickly that this is just, it's an illusion. Unfortunately, it's an illusion that costs people a lot of money, even at times costs people expensive, invasive medical care and their lives. And that is really terrible. So I have a huge investment in trying to help people understand this. So my belief, just based on 15 years of really investigating this clinically, is that the body doesn't just break. It doesn't just randomly go into a disease state and things get inflamed for no reason. You need to find the reason for the pain. But the central issue is pain is not necessarily related to injury. Most of the time, it isn't.